This is Dr. B. Murali Mohan, Consultant Intervention Pulmonologist and Sleep Specialist at Renault Hospitals, Kompally. Today I am going to tell about sleep apnea. In India, people ignore snoring. They don't know the complications of snoring. Most commonly, snoring is seen in obese patients. Nowadays, some software companies are giving bonus if the patient reduces weight. Sleep apnea. What is sleep apnea? Sleep apnea is cessation of respiration during sleep. A patient, when he sleeps, he'll have frequent choking sensations, nocturnal awakeness, fragmented sleep, early morning headaches, daytime somnolence. These are the most common symptoms of obstructive sleep apnea. And the patients who are obese, they are more prone for developing obstructive sleep apnea. What is body mass index? Body mass index is weight in kg by height in centimeter square. In patients whose body mass index is more than 30, they are more prone for developing sleep apnea. Most of the obese patients, they are associated with comorbidities such as diabetes, hypertension and thyroid. These are the most common comorbidities associated in obese patients. So, obstructive sleep apnea. What are the complications of obstructive sleep apnea? The most important complications of obstructive sleep apnea are heart attacks, arrhythmias and strokes. How do we diagnose obstructive sleep apnea? In Renault Hospital, we have a sleep lab. In this, we ask the patient to come for overnight polysomnography or sleep study test. In this test, we ask the patient to sleep in our hospital for overnight and all the leads are connected to his body. Depending leads are connected to his body, there are certain parameters which we follow. So, they are apnea hypopnea index, oxygen saturation levels, periodic limb movements. These are the main criteria. So, depending on apnea hypopnea index, we categorize the patients into mild obstructive sleep apnea, moderate, severe. If the apnea hypopnea index is more than 30, we consider them as severe obstructive sleep apnea. Those type of patients are more prone for getting heart attacks, arrhythmias and strokes. So, after this test is done, we ask the patient to go for overnight sleep titration study with CPAP machine. Once the patient undergoes titration study, we ask them to use the CPAP machine at home. Once the patient starts using CPAP machine at home, his long-term comorbidities such as diabetes, hypertension and thyroid will be under control. His quality of life improves. Daytime activeness will increase. Once all these parameters improve, the patient has to start reducing his weight by doing walking exercise. In obese patients, most common cause for sleep apnea is the tone of the neck muscles is reduced and there is a soft tissue deposition in the throat and the tongue. When the patient sleeps, the tone of the neck muscles is reduced. The soft tissue which is deposited in the throat and neck tries to close the airway, resulting in sleep apnea.